Foramen we will discuss today the Norma Basalis, and we divide it into three parts: the anterior part, the middle, and the posterior. Let's see. The anterior part bounded anteriorly by the alveolar arches, and posteriorly it is bounded by the posterior margin of the heart palate. The middle part is present in between the posterior border of the heart palate and up to a line transversely running imaginary anterior to the foramen magnum, and the part now posterior to that imaginary line is the posterior part. Now simply again you can see the anterior part and the middle part and the posterior part, and being represented by the two demarcations, right? Now we will discuss the anterior part first. You can see here the heart palate and how it is formed. It is formed by the palatine process of the maxilla bone, and they are making a suture called as intermaxillary suture. Now you can concentrate that there lies the horizontal plates of palatine bone and forming a suture called as interpalatine suture. Now these both articulate to form a cruciform suture and lies between the palato-maxillary bones, right? And here in the heart palate, you can see just below the incisive teeth, you find the incisive fossa, and on its both sides, there are two incisive canals, right? Now, what else you see? You find the greater palatine foramen and the lesser palatine foramina on the adjacent sides of the molar teeth. In the center of this heart palate, posterior border is pointed and is showing the posterior nasal spine, and you can also see the palatine crest on both sides, and here you can visualize the posterior nasal apertures. Now what else? Now come towards the middle part of the Norma Basalis. Here in the center, the perpendicularly arranged bone is called as Vomer along with its two ala. Now concentrate in the center. This broad bar of bone is formed by the articulation of the body of the sphenoid and basilar part of the occipital bone, forming the basi-occiput, right? Now see on the adjacent side of the vomer bone, and from you can see the body of the sphenoid, there are two other processes called as pterygoid processes being marked with the green color, and on its lateral aspect you find the greater wing of sphenoid, right? And let me make you clear that these pterygoid processes consist of two plates, the medial pterygoid plate placed medially and the lateral pterygoid plates, right? And see the positioning of the lateral pterygoid plate, and in sagittal view again it's being shown to you that where lies the lateral pterygoid plate, right? Now see the medial pterygoid plate. Its posterior border is elongated or prolonged to form the pterygoid gemellus. You can see it very well. Now in between the two pterygoid plates, there is a fossa called as pterygoid fossa. You can see them as present bilaterally in between the two pterygoid plates, right? Now you can see that the upper end of the posterior border of medial pterygoid plate encloses a small triangular depression. It is called as scaphoid fossa. And now you can see the sphenoidal process of palatine bone. And just below that, you can observe the vaginal process of the medial pterygoid plates. And now you can see that on the adjacent side of the vomer bone, we have got two canals. The medial canal along with the vomer bone is called as vomerovaginal canal, and the canal along that medial pterygoid plate is called as palatovaginal canal, or you can name them as pharyngeal canal. Now another picture to elaborate these different canals, the processes so that you can make a clear concept. Now, along with this picture, we have to concentrate on the sagittal section. When there is the removal of mandible, you can find the pterygopalatine fossa, that is another important landmark. Now see how the vaginal process of the medial pterygoid plates are present, and you can see the alley of the vomer on the adjacent side of the vomer bone. Now see the greater wing of sphenoid present on the Norma Basalis, how they appear laterally. This is the area where we can get the greater wing of sphenoid. Now here in the picture you can see that the greater wing of sphenoid is perforated and there lies an oval foramen called Foramen Ovale. And let me show you that what it transmits. You can make the mnemonic MALE male, the mandibular nerve, the accessory meningeal artery, the lesser petrosal nerve, and imaginary vein. And just lateral and a little bit posterior to it, you find the foramen spinosum, and you can find the spine of sphenoid here, right? You can see them on both sides. See the structures that are supposed to pass through it. The recurrent meningeal branch of your mandibular nerve called as nervus spinosus. Now here again you can see that where lies the sphenoid bone, its greater wing, and the two plates. Just posterior to it you find the petrous part, and in between the two you get the sulcus tubi. It's the sulcus to adjust the auditory tube. In the picture you can get the carotid canal, and what structures are supposed to pass through it. Definitely the internal carotid artery along with its sympathetic plexus is supposed to pass through it. Now see where the Foramen Lestrum lies. You can visualize that on the adjacent side of the body of sphenoid you find this Foramen Lestrum. Now in this picture the carotid canal and the Foramen Lestrum is being shown, and you can see the passageway of the two. Another important thing you find here is the mandibular fossa present on the squamous part of the temporal bone. Now it's clear why it is present. It has to make the temporomandibular joint by the condylar process of the mandible, right? Again look that there lies the mandibular fossa. And on the adjacent side of these fossa, there lies the articular tubercle, right? See on them of the both sides. In this picture, see the squamous part of temporal bone, and posterior to it, you find the tympanic plate. And you can see the positioning of a fissure, that is squamotympanic fissure. And see on the other side as well. Now this fissure, what it has to transmit, you can see the cauda tympani nerve that comes from the 7th cranial nerve, the facial, and what else has to pass? Anterior tympanic artery, and there lies the anterior ligament of Malleus. Now in the posterior part of the Norma Basalis you find the central Foramen Magnum, and on its both sides you observe the hypoglossal canal that is meant for the passage of 12th cranial nerve. Now we have to see another important landmark, the jugular foramen. The internal jugular foramen has to address, or they have to allow the passage of 9th cranial nerve, the glossopharyngeal, then the 10th vagus, and the spinal part of accessory nerve, which is 11th cranial nerve, and internal jugular vein along with the occipital artery, and you find the passageway of the inferior petrosal sinus. And this jugular foramen is divided into medial, intermediate, and lateral parts, and you can see here that these portion addresses what structures to pass through. Two other important landmark, you can find that there lies a bony projection called as mastoid process, and a thin pointed process called as styloid process, and in between them you find the stylomastoid foramen. In this picture they are showing the arrow towards carotid canal, and this picture is taken to show the internal carotid artery to pass through this canal. And here again, you can mark that there lies the jugular foramen, right? In this picture, they have highlighted the pterygoid process of the sphenoid bone. You can find the lateral pterygoid plate, the medial pterygoid plate, and on its posterior aspect, the hamulus lies there. Now you can see that largest foramen, the foramen magnum, if you divide it into two compartments, the interior compartment addressing various ligaments to pass through, and other is meant for the passage of neurovascular bundles, right? See, in the ligamentous compartment you find apical ligament of Dens, and then you can see that superior longitudinal band of cruciform ligament and membrana tectoria is supposed to pass through this interior compartment. And what has to pass through this posterior compartment? The lower part of the medulla oblongata. Recall that along with its meninges. Then you find the spinal root of accessory nerve, then meningeal branch of upper cervical nerve, then vertebral arteries, and definitely the sympathetic plexus around the vertebral arteries, right? And the most important, interior and posterior spinal arteries. They all are supposed to pass through foramen magnum. Definitely the spinal cord runs through it. Now look at the bones that take part in the formation of Norma Basalis. You can find the parietal bone, that they are covering the lateral edges of your skull. Here you get the temporal bone, right? And you have seen its the petrous part and so many other parts. You can visualize the styloid process, the mastoid process, this mandibular fossa, even the zygomatic arch portion is also there, right? Now see the contribution from the occipital bone, that how it is present most posteriorly, covering the sides of your foramen magnum, and what they are supposed to form the condyles, which are called as occipital condyles, and there lies the condylar canal, right? And they are supposed to take part in this basi-occiput, right? Now see this sphenoid bone, like a bat wing appearance. You can see where it lies. Now concentrate on the Vomer bone that is present in between, and if you observe the sagittal section, you find in the nose where lies the Vomer bone. And here you can see the contribution of palatine bone in the formation of hard palate along with its pyramidal process and the formation of posterior nasal spine. Now look at the zygomatic bone, that how it appears. Now see the contribution of maxilla, right, in the hard palate and on both sides as well. Oh, there is a frontal bone as well, a little bit portion present on both sides, right? So this is how your Norma Basalis is completed. You can see the incisive fossa there. Now we can sum up the greater and lesser palatine foramen, and now we can see the mandibular fossa, and you can observe the stylomastoid foramen, jugular foramen, and then there is a labeling of occipital condyles, and you find that there sometime lies the mastoid foramen, and the condylar canal are being marked on both sides, and you can see the foramen magnum. And here colored picture will show you the distribution of different bones taking part in the Norma Basalis, right? And a little bit more. This part will show you the pyramidal process of palatine bone where it lies, and you can see the pterygoid hamulus of the medial pterygoid plate. Now another important thing, let me make you clear that you can see on sagittal view of this nasal area that where lies the perpendicular plate of palatine bone, right? And on its upper aspect you find the middle and the superior concha, which are a part of ethmoid bone, right? And inferior nasal concha is an independent bone, right? This picture I want to show you to make you clear the location of various plates. And here again concentrate that in the cut section of this nasal area you find the pterygoid humulus below, and above that in between vertically address the vomer bone, and on its superior aspect you find the perpendicular plate of ethmoid bone, right? Interior to it you find inferior concha, and on the top you get the nasal bone along with the nasal spine of the frontal bone, and you can visualize the frontal sinus over there, right? This is how these pictures are being completed. Thank you very much.